Welcome to another edition of the Damie Vlog. My name is Dr. David Duizer. I'm a naturopathic doctor in Vancouver, British Columbia, and the medical director at damiehealth.com. Thank you so much for tuning in. On this show, we cover all things holistic health and wellness related. If you're interested in holistic well-being, this is the channel for you. Please subscribe. We're going to be doing many more videos like this. Today on the show, we're talking again about the transition into flu season, from summer into winter. We have seen so far, just after the first week of school, a significant increase in the number of colds and flus come in the clinic. You're probably experiencing the same thing in your community. We do a lot of things in the prevention of colds and flus in holistic medicine. We also have a series of different protocols we use when someone comes down with a cold and flu. Today I'll be reviewing just the basics and a few other things about the immune system and this time of year. In the previous few videos, we were talking about how dark it gets in Vancouver in the winter and the effect that can have on the mood. We also know that low vitamin D can be a contributor to a weakened immune system. So if you're someone who gets sick all the time, getting a vitamin D check might be necessary to see if the amount of IUs you're taking is enough to keep your immune system strong. We respect the reference ranges that the labs have put in place, and we try to keep people in those reference ranges. We believe that when the vitamin D is in those reference ranges, that portion of immune function is taken care of, and we don't have to consider it any longer. So that's important as a transition from the previous few videos, because in the previous videos we were talking about blue light and how mood can be affected when it starts to get dark. We've already seen that here in Vancouver just in the first few weeks of September. But, now these colds and flus are coming on, and we have to refocus on keeping the immune system strong. Vitamin D is an important part of that. When someone gets a cold or a flu, there are a few things that we focus on initially as a well-rounded, holistic approach to immune function. Of course, we're doing vitamin C, zinc, and probiotics. These are things we use because we know they speed recovery from colds, from just the basic cold. We know that people can do better. They can heal quicker if they are supported well with vitamin C, zinc, and probiotics. It, of course, depends on the case. If there is no cold, if there is no flu, then we tend to not jump on probiotics as a preventative measure. Some will, some won't. I have seen too many negatives happen with people self-prescribing with these supplements that I can't just recommend anyone go and take them in prevention. It's important to have medical advice from someone who knows what they're doing before you begin these. For probiotics, it's very easy to throw your normal flora out of balance with a probiotic. We have people who jump to 50 billion, who jump to 100 billion probiotic, and all of a sudden their bowel movements are changing. That is just not good for your overall health, and I do not believe should be done on your own. With zinc, we see people taking zinc all year round, and then they have the potential for running into copper deficiencies. So it's better to have your zinc and copper managed by someone who knows what they're doing. Vitamin C in low doses is safe for most people. In colds and flus, of course, we go higher and higher and higher. We use higher doses because it's probably better. We just recently had another study come out that showed that IV vitamin C was effective for reducing allergic-related symptoms, which we're really excited about because this allergy season is upon us, and we treat a lot of allergies in the clinic here, and sometimes allergy medications, allergy supplementation are not effective. We have always used IV vitamin C in our clinic in allergic-related skin flares, and now we have another study showing the potential for IV vitamin C in all allergy presentations. It's not a double-blind placebo-controlled trial, but just another indication that IV vitamin C, or vitamin C in high doses, is probably really, really good in allergic-related symptomology. Of course, with IV vitamin C, there are risks as well, and we have seen it not work in allergic-related skin flares. So, but I'm excited to see this because we have seen so much benefit in the past using it for this purpose. So nice to see more trials coming out for that. But anyways, back to the immune system in general, keeping it strong. We tend to support white blood cell production when we are trying to prevent colds and flus in naturopathic medicine, we use a Western herbal approach, which is things like echinacea, astragalus, mushrooms like reishi, and Coriolis or turkey tail. We use a complex of things to keep the white blood cell system strong so that you're very well protected from colds and flus. On the lifestyle side, it's important to know that when this type of year comes around, it's important to wash your hands, to not touch your face. When it comes to exercise is helpful for the immune system, but over-exercising reduces immunity in general. So that needs to be managed. Sleep is very important for a strong immune system. And of course, eating well. Two things to watch out for this time of year is increased sugar consumption because of the dark days and the shorter days. People tend to get more cozy. They tend to eat higher caloric density foods. I know already Amy and I have found that we're turning to higher caloric density foods as we transition to this next season here. So watch out for that. Watch out for high sugar foods this time of year, and also watch out for overeating this time of year. In fact, if people around you are feeling unwell, it's time to consider inquiring about a low-calorie diet for a while, or a cleanse or a fasting protocol for a while. Inquiring about that might be helpful for boosting immune response. One simple thing we check in with is when we sense that we're overeating or we're overdoing it, we'll jump right back into 13-hour intermittent fasting and just make sure we're not eating before bed. This can be really helpful for boosting immune response in general. Those are a few of the lifestyle things we do. Make sure we're exercising but not overdoing it. Make sure we're avoiding high caloric density foods. Make sure we're avoiding excess sugar, and sometimes considering the dramatic reduction in sugar or fasting in general to support immune response. Of course, sleep, and then on the supplementation side, we're using vitamin C, zinc, probiotics, and then as an immune boost, we're doing echinacea, astragalus, and mushrooms for immune support. That's without going into specific nutrient therapies beyond vitamin C and zinc, but that is the basis of any program in my clinical practice for boosting the immune system, preventing colds and flus, and then subsequently treating them if they are occurring. With treatments, of course, it gets much more specific. If we know there's a bacterial infection, we'll do antibacterial herbs or antibiotics if needed. If we know there's a viral infection, we have herbs that we know are effective in viral infections that we'll use. Often we're turned to Ligusticum and Lomaceum. In bacterial, we're looking at golden seal, berberis. These things can be helpful if we know there's an active infection occurring. That's kind of the naturopathic approach this time of year. Of course, it gets more and more detailed with more and more information from the patient, but that's how we kind of look at the protocol. Thank you so much for watching. If you're interested in holistic health and wellness in general, please subscribe to our channel. We'll be doing many more videos in this genre. Thanks for watching, and have a great day.